Hi there, here's Elizabeth Salkers, and today I want to share how trust is essential for an effective communication with patients. Trust is one of the most important aspects in human life, and it plays a really key role in the communication with the patients and impact in their health. Trust is fundamental in healthcare and it permeates how much patients trust their doctors, clinical decisions, trust all the healthcare providers, and trust public health organizations. So you may ask, how do we build trust? Trust is built on relationships. It's an essential component of the therapeutic relationship between the doctor and their medical provider. It's hard for patients to trust providers that they don't know or that they feel like left them behind. And this is especially true among minorities and vulnerable populations that may have traumatic past experience or bad experience with the healthcare system. Trust doesn't happen in warp speed. Trust is about interactions, numerous interactions. It's about listening, dialoguing. It's about truly caring about the patient. Trust is about human interaction. It's about human connection. How about misinformation and disinformation? In the last couple years, misinformation and disinformation has been rampant on social media, schools, workplaces. Today, patients are more vulnerable to misinformation and disinformation, which has contributed to problems such as vaccine resistance, distrust in diagnosis, and the lack of adherence to medications and to treatments. So how can healthcare organizations and doctors build or rebuild trust with their patients? First, it's important to understand that trust is influenced by various factors, by economic, social, political factors. It's influenced by the history of the community, by past experiences, and that it may affect how these communities and how these patients interact with the healthcare system. So it is important for healthcare providers and healthcare organizations to integrate with these communities, reach out to them, learn more about them, show that they care, understand what they are concerned about, to start building this trust. Second, trust building initiatives should not be a one-time thing, should not be limited to public health crises like the COVID-19 pandemic, but should be an ongoing effort from healthcare organizations and from healthcare systems to work with the communities that they serve. There is no quick fix. It is imperative for healthcare organizations to integrate with the community that they serve, to care about them, and to start establish strategies to build trust with these communities. Here are some simple strategies that healthcare organizations can use to start building or to rebuild trust with their patients. Build and sustain long-term relationships with the local community. Invest in community outreach initiatives. Ensure the access to clinics, hospitals, and mobile units have personnel that is representative of the communities that your organization serves. And speak with communities in their language and address the issues that most concern them and that they care about. Trust is central in the communication with the patients, and it is crucial in the delivery of quality healthcare. However, the building trust is a long-term commitment, and it is going to require lots of energy and resources from healthcare organizations and from government. Thanks for watching. I would like to take the opportunity to invite you to subscribe for my newsletter on LinkedIn, the Health and Marketing Talking newsletter.